I'm Dr. William Richardson of the Atlanta Clinic of Preventive Medicine, and today we want to talk about gastrointestinal problems or diseases of the digestive tract. I want to start off by saying that a lot of this starts in our lifestyle and with psychological aspects. There can be psychosocial stressors, loneliness, and we're going to talk about how this ties into the digestive tract. In Chinese medicine, the two organs that are associated with emotions most are the large intestines and the lungs. Stress management factors, fear, depression, low self-esteem, all have to be managed properly to avoid digestive problems. I want to read a quote from one of the papers that we wrote earlier. Improper lifestyle, faulty dietary habits, environmental pollution, yeast, candida, parasite infestations in the gastrointestinal tract, misuse, overuse of medications, and vitamin, mineral, and nutrient deficiencies, as well as unbalanced mental, emotional states are major contributors to health problems. Since antiquity, Imhotep, the African father of medicine, and Hippocrates have both talked about the mind connected to the body and stress lifestyle factors, and that's thousands and thousands of years ago. If you take the time and make the effort to learn and understand your own body functions and use the herbs, learn the nutrition, you can have a very profound and lasting effect on your health. Much, much more than the TV advertisement, Hollywood drugstore type of mentality as far as treating the symptoms with covering up drugs. Whereas you can use our methods, which are preventive in orientation, and get to the root of the problem, and many times permanently eradicate health problems and infestations and whatever else one may be suffering with. I want to go over the gastrointestinal tract on an anatomical basis, that is the structure, and then relate that to function, and then relate that to treatment. We want to start with the mouth. That's a very obvious beginning of the gastrointestinal tract. Mastication is chewing. You have to have proper dentation. You have to make sure that your dental work is up to par. If you're missing a lot of teeth, that needs to be corrected. The psychological aspects, taking the time to slow down and eat properly, to chew all your solids into liquids and to chew your liquids. Mouth ulcers, all that has to be taken into account. Salivation, that is the outpouring of saliva. One has to be properly hydrated. It is wise to keep your water intake up during the day, and a good time to do that is before one eats. That'll ensure that you have enough saliva because you'll be well hydrated. Also, the pidolin is the type of enzyme that comes out from the mouth to start the digestion of starches. So you want to watch your food combining. You don't want to, and we'll talk more about this, but you don't want to eat a heavy protein with a heavy starch at the same time, because you'll cause haywire in the digestive processes. And then we get to the throat. We have sore throat, we have thrush and all that sort of stuff. Those are particular diseases that need to be treated appropriately, because that'll also cause quote-unquote malnutrition. Malnutrition probably is one of the bottom lines to the gastrointestinal tract. That is, if the protein level's dropping in the blood, that means that there's a problem. And we're going to talk about the esophagus next. The esophagus is the tube traveling from the mouth down into the stomach. The esophagus traverses all of this space. It's a hollow tube. It's a muscular tube as well. And there are some very important things to mention about the esophagus. Number one, one has to have the proper timing in eating. One does not want to just gulp down solid food and then gulp, and that's without chewing, and then gulp down a bunch of liquids to wash it down. That's going to hurt and scrape the esophagus. You want to take care of it by chewing your food properly. There's a great list of eating rules in our Keys to Health handout that I urge you to review. We have talked about this before. Limit eating when not hungry. Bring a tranquil mind to meals. All this is going to cause smooth transition of the food from the mouth to the stomach with gentle peristaltic actions. Tobacco and alcohol need to be avoided because that can actually cause esophageal as well as gastric cancer. That's a lot where stomach cancer and esophagus cancer comes from, is tobacco and alcohol. Food combining, again, is very important here. We can get inflammation of the esophagus from reflux of the gastric contents up into the esophagus. So let me explain that. If you eat a large meal and then you eat 3 glasses of water, and you cause, first of all, you'll cause dilution of the gastrointestinal enzymes and the gastric juices, and secondly, you'll cause a reflux up from the stomach into the esophagus, causing an inflammation of the esophagus, which is esophagitis. This can lead chronically to esophageal cancer as well, and that's called gastrointestinal reflux disease. The drug companies are making big money from this disease because people do not know the basic eating rules, the basic food combining principles, the timing of food. All of this is important. So many people are suffering from gastroesophageal reflux disease. This many times can be eliminated by proper timing of food, that is eating fruit in the morning, not eating fruit after a large meal. That's like eating a dessert after a large meal. Like they say, dessert. You've heard that before, many of you. There's some very good principles in this food combining guide right here that I urge you to read. It's by Wayne Pickering. And we'll refer to this more, but I urge you to read every word on this chart. Well, that brings us to the stomach. And one thing that I want to mention initially is that you have to stop eating before you feel so full. You know why? Because it takes 10 to 15 minutes for your brain to register that your stomach is actually full. Why it's good to push back your plate when you're 3/4 full, because usually in 10 or 15 minutes you'll be totally full and satisfied. In diabetics, because of poisoning of the nerve, that can take a half hour. So diabetics have to be very careful with their stomach. Also, diabetics can get poisoning of the mechanisms of movement of the stomach. It's called gastroparesis. So we have to be very careful with that. And remember, one man's medicine is another man's poison, and vice versa. So some people, it's very important for them to eat fruit. For actually most people, it's very important to eat fruit first thing in the morning. For some people who have active colitis or active stomach ulcers, you don't want to necessarily eat raw fruit first thing in the morning. So you have to differentiate where you're at. For most people, raw fruit first thing in the morning is the ideal food. Okay. I want to now say why it is so important to eat fruit first thing in the morning. Number one, the food is a simple food to digest in the morning when the digestive tract is just waking up. Number two, it's a great elimination food. In other words, it has roughage, it causes an elimination of the bowel contents through bowel movements, and it gets you a lot of energy because of this elimination process, and it doesn't slow the body down with a lot of digestive processes from complicated food. It's a very simple food as well. It's full of water, it's great for high blood pressure. Okay? The people who may have to limit it include people with strong candidiasis infestations, very strong diabetes, that those people may have to be careful with how much fruit they eat and what type, because some fruit is sweeter than other fruit. For instance, bananas, it is no longer the best source of potassium because of the high sugar content of bananas. The best sources of potassium and other minerals now is vegetable broth and vegetables in general, greens and things like that. The stomach, one of the main complaints and problems of the stomach is indigestion or dyspepsia. Pepsia is digestion and dis means awkward or not normal, so it's an indigestion. Again, food combining is very important. Remember, the stomach pours out acid when one consumes a high protein food such as meat or dairy, etc. Whereas if you consume a starch, the stomach will not pour out this acid. The starches will be churned in the stomach and mostly digested. Well, the digestion of starches starts in the mouth with the pidolin, that enzyme. Then that goes down in the stomach with the starch and continues to work. And then when the stomach empties into the small intestine, which is the duodenum in the beginning of the small intestine, is called the duodenum, then outpourings of pancreatic enzymes come and really digest those starches. Whereas high protein foods are really primarily start their digestion in the stomach with an acid outpouring. Now one needs an alkaline environment in the small intestines for the enzymes of the starches and the fats to work. That's an alkaline environment. And if you've eaten a high protein food with that starch, then that's going to put out a lot of acid in the stomach, which is going to be emptied into the small intestine and counteract the enzymatic activity of the starch. In other words, you're going to get a foul up of digestion by combining a high protein food with a high starch food. We'll talk about this more, and of course some people can handle a little bit of imperfection with that rule, but some people cannot, and it all depends on where you're at. But different people have different strengths.
What can you mix with starches?
Well, the question is asked, what can be mixed with starches and what can be mixed with protein? Well, basically, starches can be mixed with vegetables. That's a very good combination, and they will not interfere with each other, especially the the green or the starchy vegetables will combine with starches quite well. Whereas the relatively non-starchy vegetables or the green vegetables will combine well with proteins, and that would include cabbages, broccoli, celery, dark green leafy vegetables, etc. Whereas with the starches, you can also combine squash, potatoes, carrots more easily. And we'll get more into that. Food combining, food timing for the stomach. You know, it's very important to start with a water. Then if you're going to use juice, go to juice. Then if you're going to eat some more raw food, eat more raw food like a salad. And then go on to the lightly cooked food like steamed vegetables and roasted or baked foods. It's a gradation of from the simple to the complex, from the liquid to the solid, from the uncooked to the cooked. And if you follow that principle, the stomach will really love you. Whereas if you combine cooked, liquids, uncooked, all in the same meal, it can be a problem. Now, it's not to say that you couldn't eat some salad with your main meal. That is certainly permissible. But you certainly don't want to eat a lot of liquids with the meal or a lot of liquids after the meal. And that will enhance efficient digestion, which will prevent a lot of digestion problems. Now again, you have to chew your food well, you have to be well hydrated, that is enough fluid in your system, mainly water. And then you have to be aware of how much raw, enzyme-rich food you eat versus cooked, enzyme-poor food, because the gastrointestinal tract is stressed when it has to pour out enzymes to digest food. Remember, in ancient times, original man used only raw food, as the animals only eat raw food. Right now, mankind is the only animal that eats cooked food, drinks milk from another species after it's weaned, and some other things. So, and eating 7-course meals and all that. Whereas animals eat much more simplistic. If they eat meat, they just eat meat, and maybe they eat it with some greens. Chimpanzees, monkeys, gorillas, and primates, they eat mostly fruit. Once in a long while they'll eat some meat and they eat it raw, and they may eat it with some dark green leafy vegetables they just pick from trees or bushes. Whereas the true vegetarians include the hippopotamus, the giraffe, the elephant, the horse, the donkey, etc. All they eat is vegetables. Maybe they eat a little fruit now and then, but they eat no meat, and they eat lots of it too. The true meat eaters are the cats, the dogs, and the reptiles in general. Man has been considered omnivorous because he can technically eat, he can get anything in his mouth anyway. And certainly there are groups of people who have survived on particular foods, and that's just what you had to survive on. The Eskimos may eat a lot of blubber and eat a lot of raw fish, and guess what? They eat it raw. You know, certain groups have had to eat insects, good protein. But for many people, that's not going to be an option they choose. So you want to be aware of the enzymes. Now, there's a great book here. Hubert Centillo is a herbalist I met years ago. He's a very good herbalist. He wrote a book recently on food enzymes, and he describes the necessity of eating raw food when one is trying to lose weight, for instance, because the enzyme that breaks down fats is going to be destroyed in cooked food. And that's why eating just a low-calorie food that's cooked may not be as effective as eating more bulky, low-calorie, high-fiber, and raw foods. So I think that one has to really keep this in mind. Now, many times what we can do is measure the acid content of the stomach to make sure that there is enough acid in the stomach to digest proteins, and if not, we can add acid. We can measure this by one of the tests, which we'll get into later. Also, one can take natural plant enzyme therapy by mouth, made by Tyler. I don't know if we have that here.
There's a gastritis.
There's a gastric complex here. This is one of the plant enzymes that we use. Very, very good for digestive problems. Now, this one does not have an enzyme that digests protein, so this would be appropriate for using with someone with a stomach ulcer or inflammation of the stomach, whereas the other one, called similase, will be appropriate for all other problems and food absorption problems. And that's because the protease that is not in this one will digest the stomach, a raw stomach, or as let's say an unprotected stomach, a stomach unprotected by its usual mucosal and mucous membrane that has been destroyed by an ulcer. Fried foods are notorious. Fried foods should be avoided. We're not talking about lightly stir-fried vegetables like the Japanese and some health-conscious people use here. I'm talking about deep-fried foods. Why? Think about this. One regular-sized potato is 150 calories. When you fry the same one up, that's 450 calories. That's 300 calories of grease. What that grease does is go and coat the carbohydrate contents of the potato, effectively blocking enzymatic breakdown of the potato. Fried foods are very difficult to digest because of that very reason. Also, of course, they're high in fat, and I'm sure will be found to be a source of cancer for cancers that are associated with fatty foods. Also, fatty foods in general can help retard digestion. Fats can be eaten with starches, but they're not well to be eaten with proteins in general. So let's take a break and put our food combining chart back up. I also want to talk about different herbs that can stimulate digestion and stimulate decrease in gastric emptying time. These herbals, let me move this around. First of all, again, I can't overstress the importance of being well hydrated when you want to partake eating. There are quite a few herbs that stimulate digestion. One of them is capsicum or cayenne pepper. When I traveled to West Africa, the West Africans use cayenne pepper like most Americans use black pepper and salt. Cayenne pepper has been found recently in studies to speed the gastric emptying time and may be very helpful in diabetics with gastroparesis and other digestive problems. Many times we are so used to eating something sweet. Occasionally we need bitters in our diet to enhance our digestion. This increases, all these herbs I'm talking about, increase the gastric and pancreatic output of enzymes and also juices. It increases the efficiency of movement through the body of digestion. We need our bitters. Licorice is very soothing to the gastrointestinal tract. It's good for mucus problems in the gastrointestinal tract, and it's good for digestion, stress, and many other things. One can make a tea out of this, can take the capsules. Fenugreek and thyme and turmeric and garlic. This is garlic, and we use this for deep gastrointestinal problems and hypertension. And the fenugreek and thyme is good for not only stimulating digestion and flavoring food in general, it's also good for mucus problems of both the gastrointestinal tract as well as the mucous membranes. Other foods that stimulate digestion include peppermint, peppermint tea, or pepperminted foods, for that matter, can stimulate digestion. Pau d'arco, a very wonderful herb from Brazil, from a Brazilian tree, the bark of the tree. This is anti-candidal, stimulates digestion, as anti-tumor as well. Ginseng, the American white ginseng, the Korean red ginsengs are both very good for digestion as well. I want to talk about cow's milk. Cow's milk has 3 to 4 times more protein than human milk, and it is a great cause of thinning of the bones. I want to read a quote from a book here by Dennis Nelson called Maximizing Your Nutrition. And what he's doing is talking about dairy products. All the facts clearly substantiate the truth of the matter. Milk and other dairy products contributing high amounts of protein to the diet are the main cause of calcium loss from bones. That's right, you heard it. Milk causes osteoporosis, and studies have shown this. It is certainly not the virtuous food their advertising campaign describes it to be. In fact, cow's milk also is associated with ear infections, worsening of asthma, and allergies, all from different mechanisms. Number one, cow's milk again has all that protein which is going to be digested by acid in the stomach. The acid in the stomach is going to stimulate the stomach and other mucous membranes to produce mucus. Therefore, milk is a very mucus-producing food. Also, many people, especially children, have an immature digestive tract or imperfect one that will allow the milk proteins to get through into the body and set up all types of allergic problems. Most people who have dermatitis, eczema, such things, are allergic to milk, and many people are allergic to wheat as well. And what many times we can determine that from a food allergy panel, which is a blood test that we do to determine what foods one is allergic to on a long-term basis, not the fast allergies like the hives and things, but we're talking about more insidious, more sneaky type of allergies. And I want to point out a test that we can also check called the Comprehensive Digestive Stool Analysis. Now, what this test will show is how you're doing as far as your digestion, absorption, the type of bacteria you have in the colon. And I want to point that out. This is what we call an exotic test, simply because most doctors are not aware of this, and most doctors do not know to do this. The Comprehensive Digestive Stool Analysis measures digestion in the form of measuring certain fats in the stool, that is how well you're digesting the fats. Chymotrypsin, it measures the enzyme output from the pancreas. It measures how well you're digesting meat fibers and vegetable fibers. Also the pH to find out how the stomach is regulating the acid output. Absorption, it measures how well fats are being absorbed. Also, we break down the bacteriology, which is the study of bacteria. Importantly, we have possible pathogens, which are disease-causing bacteria. And this particular test will outprint a chart that will show what drugs as well as what herbals can combat these possible pathogenic bacteria. Imbalanced flora such as zero lactobacillus, for that of course we would be using Primidophilus, Lactobacillus acidophilus, and other various products that we have that are very important to replenish the lactobacillus. This will give us a dysbiosis index. For instance, this person has a dysbiosis index of 7, which is moderately abnormal. Many times we will have severe ranges here. Mycology is the study of Candida and other fungal elements. For instance, this person grew out Candida albicans, and the test will also show what drugs as well as what natural constituents will combat Candida. And invariably, the Candida is susceptible to garlic. Now, garlic has to be used in caution with someone with active gastrointestinal disease of an inflammatory nature, such as ulcerative colitis or very active peptic ulcer disease. However, if that's not going on, then garlicin usually is a very effective treatment for Candida, along with other products that we use. So this is a very good test for measuring your digestive capacity as well as what types of things are bothering your colon flora, which means the natural bacteria and all the other, some of the friendly bacteria as well in the colon. Remember, our feces or our stools are over 50% bacteria, which is very significant. Types of problems we can get from the stomach include inflammation of the stomach or gastritis, gastric peptic ulcer disease. The diet of the client is important to make sure we're eating whole foods, baked foods, non-fried foods. One must avoid alcohol, tobacco, and caffeinated beverages. Helicobacter pylorus is a bacteria that's been shown to infest the stomach, and there's been much proof that eradicating the body of Helicobacter pylorus is curative in peptic ulcer disease, that is ulcers of the stomach, and duodenum, which is the beginning of the small intestine. Now what we're going to talk about is duodenitis and the duodenal peptic ulcer disease. I want to go back to the graph up here. I think it's very important to point out the stomach. This is the musculature of the stomach here, the outer membrane of the stomach. Notice the inside of the stomach, which is producing the acid and has a mucus layer, which when broken by steroids or broken by aspirin overuse and whatnot can cause ulcers, even stress. Now this is the duodenum. This is the beginning of the small intestine, and ulcers can also occur here because of the stomach acidic contents bearing a hole in the area if it's not well protected. Yes, the duodenum is very much related to the stomach. So a lot of the same problems that happen to the stomach can happen to the duodenum. The small intestines, on the other hand, includes all of this material, and that usually measures in an adult about 25 feet, and it begins here with the stomach, and it ends here in the cecum of the colon, which then goes around and empties out into the outside of the body through the anus or the rectal area. The small intestine, one of the main problems one can get, because that's where food is absorbed, is of course malabsorption or bad absorption. This can be measured very effectively by two tests that we do. The CDSA, as I just showed you, as well as the intestinal permeability study. This measures how well the body or the intestines can absorb a large sugar, which is hard to absorb, and a small sugar, which is easy to absorb. And then that's measured through the urine. What can happen, we can get what we call leaky gut syndrome, where the intestines let all types of larger than normal food particles be absorbed into the bloodstream, setting up problems and dis-ease. That's leaky gut syndrome. Or you can have malabsorption, which usually means not absorbing much at all. You can have genetic factors such as a carbohydrate intolerance. Many of you know if you eat milk, or you drink milk, or use certain dairy products, you're going to get gas. And that's because the body does not have the capacity to digest the sugar in milk called lactose. This occurs in about 80% of the general world's population, except certain areas of northwest Europe where people can continue to digest milk. That may be some type of genetic survival factor from the past. There are also things such as celiac sprue, which is another genetic disease where one cannot digest gluten. And of course gluten is in wheat and other products, and if one avoids that, then they have absolutely no problem. And that is just something that people have to live with. Now there's other, in my opinion, there's like a spectrum of diseases that probably are not well delineated, which includes certain intolerances that people may have on an individual or familial basis to certain foods such as wheat. Many people cannot tolerate wheat and milk, and if people are having trouble with malabsorption or digestion problems many times, that needs to be measured, and that's measurable by one of the tests we do. It's a blood test of food allergy panel. Worms can infest the small intestine, all types of flukes and the larger worms, and that can usually be measured through stool outpouring content, such as a parasitology test. And we'll get into that a little bit later. Inflammatory problems can occur in the small intestine, such as Crohn's disease, which is an autoimmune disease, which we'll talk about later again. Large intestines, that's again this larger intestinal area, and it starts right here. This is the appendix, and that's many times blocked by constipation. We're going to talk about constipation now. And the contents of the food is mostly absorbed, the good parts are absorbed in the small intestine, and then it's dumped in the large intestine where the water is usually absorbed. However, if the transit time, or that is how fast the food travels through the large intestine, is too quick, then that's why you have diarrhea. If it's too slow, then you have constipation. The number one problem in this society is still constipation. Constipation varies with the attitude, the definition of constipation varies with the attitude of the author, but mostly it's a chronic, uncomfortable state. It's a matter of discomfort, necessarily more than frequency. The bowel movements are irregular in shape and size and uncomfortable, typically hard and small. Bowel movements, in my opinion, should be at least 1 to 3 times a day and at least 1 patient foot or more longer. Now, patient foot is by definition how long the foot of a patient is, because it wouldn't be fair for someone 5 feet tall to be compared with someone 8 feet tall. Yes, so what can happen when one is constipated? Well, this is a picture of a healthy colon. And we saw it before. Here's the small intestine emptying into the colon. And then the food, or the intestinal contents, I should say, goes around transverse colon down into the sigmoid colon, which is the S-shaped area, and then out through the anus. That's a healthy colon. Let's look at some unhealthy colons. Aha! Look at this. unhealthy colons. Now, diverticular is when the intestines punches out through the outer layer, and that directly comes from constipation. Spasms can come from constipation, as well as emotional problems. Strictures, this can come from cancer, if there was a cancer around here, as well as just spasms. And then this is a prolapse of the colon, in other words, when it drops down and droops. All these things can be related to constipation. Constipation causes intestinal toxicity, as well as general body and physical and mental and even spiritual toxicity. This occurs because of putrefaction and fermentation of foods that are not moving through the body quick enough.
What is that?
Putrefaction is a rotting of the food. Some of you may have gas problems, and it may smell pretty bad, and that's sometimes because the food is actually rotted because they're not moving and not being digested properly. Fermentation is when the food's sitting there not being digested. Well, the bacteria are going to digest it, and they're going to produce alcohols and gases and poisonous gases, and that's fermentation. Basically, toxic chemicals are produced and absorbed through the colonic mucosa into the body by way of the bloodstream. That means that you have a manufacturer. Anybody feel, let's say, headaches, haziness, mental fogginess, just plain sick with constipation? That's because these chemicals are being released into the body. And this needs to be eliminated. In fact, alcohol can be made, and people have gotten drunk from toxicity. That's right. So this is a true intoxication. Constipation can be relieved by many treatments, and that's a very important subject. So let's talk about that now. First of all, water is very important in preventing and treating constipation. One needs to drink at least 8+ glasses of water a day, depending on the type of food you eat. One eats more raw food, that may not be as necessary, but for most of us it's quite necessary. Also, a high fiber food intake, food that is not processed. Bran foods, whole grain, bread, cereal, all sorts of things like that. Starches that have a lot of fiber, all these fibrous vegetables, all these fibrous fruits, all can promote bowel movements, especially if they're not overcooked and cooked dead, that is, with enzymes dead and the fiber broken down to a ridiculous amount. But these are very healthy foods, whereas flesh and dairy foods have no fiber and can promote constipation if taken in excess. For every piece of meat you eat, you need to eat 3 or 4 times as many vegetables in weight. That's a very important principle. I want to point out some herbals that we use to help things along. One important product is the Dowie Cleanse. And this is a combination from Nature's Sunshine, which has 6 different herbal formulations. Basically, there's a bowel cleanser, a bulk-forming laxative, and other herbs to tone the liver and detox the blood of the body. And this is a very good way to start on a detoxification program while mixing it with a non-flesh, non-dairy diet for about 10 days, 10 to 14 days. You can spread it out if necessary. One has to be careful with herbals. These come in packs, and this is easily carryable throughout the day. It's suggested that you start with 1 pack and take it with a main meal and see how that goes. And then if you do that fine, then go on to 2 packs a day, and then 3 packs a day. And that will depend on how often your bowel movements are, whether they're very loose or not. And we don't want to be excessive with that either. There's other combinations that we use, like lower bowel stimulator. That's Cascara sagrada, which is an individual herb, which is a stimulatory laxative. You would not want to use even a herbal stimulatory laxative indefinitely, because you could get overuse of that herb. However, bulk forming herbals such as psyllium hulls, which I don't see here, but it's in a bottle similar to the slippery elm. That's what they make Metamucil out of. And what that does is actually act as a broom, and that's what whole grain bread does. Remember, stay away from any refined products such as white rice, white bread, etc. You want to eat whole grain foods only, and you definitely want to eat a lot of fruit. You want to eat a lot of fruit, especially in the morning, because that's a good cleansing food, whereas if you're eating nothing, or you're eating eggs, bacon, sausages, etc., that's going to foul your digestive tract up as well as increase your chances of cancer. Basically, constipation can lead to secondary diseases such as diverticulosis, again, which I showed you a picture of, which is outpouching of the bowel, and then diverticulitis, which is inflammation of those little ticks or pouches. Appendicitis, because of fecalith, or in other words, a hard piece of constipated fecal material can block the appendix output and cause an infection. And also colon cancer, because of the decreased movement of food and the putrefaction, as we mentioned, which is the rotting of food, causing chemicals which irritate and cause cancer in the colon, of course, as well as a high-fat diet along with it. And you want to stick to your basics to prevent all this: your water, your exercise, your diet, your fruit, your herbs. Those are very basic things that you can use, of course, early in life the better, to actually prevent this disease. And the fruit prevents, and this whole scene that we're talking about prevents toxicity of the body. Next, we want to talk about bacterial problems in the colon, or bacterial overgrowth, or dysbiosis, which is just bad state of affairs of the bacteria of the colon. One can have overgrowth, pathogenic bacteria, which is disease-causing bacteria, imbalanced flora, which means not enough of the right type of bacteria like acidophilus, and one can also have parasites, major parasites and minor parasites. Important tests, as we had mentioned earlier, is the comprehensive digestive stool analysis, which shows a state of affairs of the digestive markers, the metabolic markers, the bacteria, and the fungal contents of the stool. But then another test that's important is called the comprehensive parasitology, which will give you pictures of whatever parasites they find in your colon, as well as the name of the parasite, for instance, Blastocystis homini, Giardia, Lamblia, etc. And specific tests are used to check for Cryptosporidium and Giardia. Now, these are all parasites, and that can be treated many times by pharmaceutical agents as well as some natural agents. And then we drop down to the same bacteriology and mycology is found in the CDSA, or the Comprehensive Digestive Stool Analysis. This is called the comprehensive parasitology, and usually we do a purge and just a regular stool sampling method. So these are very, very important tests. Another important test is the intestinal permeability study, which basically will tell you how well you are absorbing, or how, if you're absorbing too much. This is an example of an intestinal permeability study, which shows an out-of-range test actually with a leaky gut syndrome. And many times this leaky gut syndrome can be related to food allergies or problems with the type of bacteria in the colon. Basically, we want to stress that we do have proper and really excellent tests here at the Atlanta Clinic of Preventive Medicine for diagnosing and as well as guiding treatment of gastrointestinal processes. And this is a great opportunity for many people to permanently rid themselves of gastrointestinal problems. The name of these tests again include the comprehensive digestive stool analysis, the comprehensive parasitology, the intestinal permeability study, the food allergy panel, and Helicobacter pylorus test. That's usually an antibody test, and that'll help us rid you of ulcers. I want to point out that except for the Helicobacter pylorus test, many doctors are not aware of this test, of these tests that I mentioned. And these tests can help get to the root of your problem and help solve many medical problems and also prevent problems in the long run. This is a very effective diagnostic method and treatment guide for candidiasis, because this gets right to the candida itself. It tells you whether you had it, whether it's dying off, what type of natural substances as well as medications can be used against the candida. Another important point is that all of these medications that are offered in drugstores and things a lot of times just suppress the symptoms and the illness is still there, whereas this particular method is getting to the root of the causes and you can get some real solving of the problems. I think that's very, very important to stress that opportunity. Some of the treatments that we use for chronic problems with bacterial overgrowth, a lot of times if the person is constipated, we'll start with the Dowie cleanse again, and then this time we'll follow it up with what we call a para cleanse. And this, of course, contains black walnut, caprylic acid, turmeric, clenthane, etc. And that's basically helping parasites. Another thing that we use again is the garlicin for parasites, as well as for bacterial growth, as well as for candidiasis. Another important thing that we use, in fact probably the most important thing, is the biocidin. This is a botanical concentrate of quite a few herbals that usually combats the pathological bacteria quite well. And we use this and the garlic and the herbals in a synergistic method where they add to each other. Also, I want to mention stevia. It's now it used to be banned by the FDA, and this ban has been lifted. This stevia is a herbal from South America, I believe Brazil, which is hundreds of times sweeter than sugar, has no caloric value, will not hurt diabetics, people with candidiasis. In fact, it fights candida. It helps enhance the bacterial content of the colon, and it also stimulates digestion. It is a wonderful herb. In Japan, during the FDA, there were about 70% of all Japanese drinks being sweetened with stevia. So this is a wonderful herb. We also have this available in the clinic. One can make vanilla pudding, all types of drinks. This can be used in cakes and pies, and there are specific instructions that we use. Okay, now again, for replenishing gut mucosa, we use acidophilus. We also have a special product called the enterogenic compound, which has what we call fructooligopolysaccharides, which are small sugars that only feed the good bacteria, whereas the bad bacteria are not fed by the sugar. So this will enhance the growth of good bacteria.
Here we go.
All right. Right now, I want to talk about some of the books we have, and then I'll get into food allergies. You know, we didn't even get to mention some of the great practitioners and healers of the past, of course starting with Imhotep in ancient Kemet, which most people call Egypt. Hippocrates was a great healer. Of course, the Greeks learned a lot from the ancient Egyptians. The person I want to point out first that I was blessed to read in medical school is Jethro Kloss, who has written Back to Eden. This is a classic and should be read by anyone interested in health, whether family or any practitioners out there, both medical doctors and naturopaths. very excellent book, and he goes over, he starts from the basic element, such as how it was in the Garden of Eden, as many people do, and goes on from there. Okay. Another excellent book is Rational Fasting by Professor Arnold Arendt. This gentleman was very amazed when he traveled to other parts of the world and saw how people ate much more sparsely and had much less disease, especially traveling in northern Africa. You know, skip a meal by fasting and you can get rid of a lot of problems and diseases. For instance, if you have a cold coming on, you'll notice that you may not feel so well about eating a large meal. If you skip that meal and drink fluids or drink some vegetable broth, which we talked about in another filming, but vegetable broth is basically simmered or boiled vegetables with bouillon, including celery, and you just drink and sip that. And if you take that instead of the meal, that one time, many times you can abate or stop a flu or cold from coming on. He also wrote the Mucilus Diet Healing System, which clarifies a lot of principles about natural healing and the mucus forming of foods. Okay, another very bright and wonderful healer is Queen Afua in New York. She talks about heal thyself for health and longevity, and she brings forth basic tenets of fasting, cleansing, and healing techniques, which is a very good book. We have fresh vegetables and fruit juices. We have many, many books here that we even sell at the clinic and many health food stores where they're available. Food Combining Made Easy by H.M. Shelton, another very dynamic and intelligent writer. Fit for Life by the Diamonds, Harvey and Marilyn, another great book. Now this book talks about it from a food combining principle, and they break down the timing. That Gregory has done that as well. Donna Gates, right here in Atlanta, we're happy to have her, wrote the Body Ecology Diet, which gives a lot of alternatives for folks with candidiasis, human immunodeficiency disease, etc. This is an excellent book for people who want to get started combating candida, who want an alternative to a lot of books out there. Health Cookbook for people who love animals is an excellent book. This is a vegan cookbook. That means using no animal products, and it's a great introductory vegetarian cookbook. And the same author wrote Pregnancy, Children, and the Vegan Diet, which talks about getting all the nutrients from non-animal sources for raising children, babies, etc. In other words, you don't need cow's milk to give to children. Please stop doing that, and please start using breast milk from the human breast. Food enzymes we talked about. Here's another book about parasites, written by a certified medical technologist. This is an excellent book that we use as a guide here in the clinic. Then we talk about mercury detoxification. Now that's the mercury fillings in the mouth can interfere with a lot of natural processes in the body. Some people more than others, and I myself have gotten all my mercury fillings out, and many people have, and many people will. Mercury fillings are banned in Sweden, Germany, and Austria right now, and that's very significant. And don't forget Robert Gray, a very brilliant writer who wrote the Colon Health Handbook. And there's many others. And of course, Bernard Jensen is mentioned. He wrote a lot of books about iridology and fasting and food combining himself. Now, I want to turn our attention to food allergies briefly again. Food allergies can manifest in a quick, fast allergy reaction, such as the hives and whatnot, and it can also manifest in chronic skin diseases, inflammatory diseases of the bowel, inflammatory diseases of the joint, or arthritis. An example that I wrote is introducing cereals and other complex, relatively complex foods too early in life, that is, before 1 year old, when pieces of partially digested protein are absorbed through immature gut mucosa and they're only partially digested because the gastrointestinal tract is immature itself and may not have all the enzymes to digest the food properly. Once in the blood, these pieces of protein set up immune reactions, which either then or later in life can cause skin diseases, arthritis, etc. And this also contributes to the leaky gut syndrome. Now what we do for that is measure in the blood through our food allergy panel what antibodies one has at a strong level to certain foods, and we avoid those foods for a certain amount of time, streamline the diet, and many times these problems literally disappear. And again, I want to repeat the fundamentals. The fundamentals include your water, your basic fruits, you're eating whole foods, exercise, rest. All of this can have bearing on all these things we're talking about. Then there are important diseases, inflammatory bowel diseases, such as ulcerative colitis, Crohn's disease. Ulcerative colitis is more a medical disease. Crohn's disease is usually a more surgical disease. Typically, Crohn's patients get 3 surgeries in life. One important aspect of inflammatory bowel disease is stress management because of the autoimmune nature of the disease. That means anything from reevaluation counseling to meditation to staring at a candle asking for forgiveness or forgiving people, praying, chanting, all this stress management techniques, because this is a very stressful world. And it is my belief that a lot of diseases such as ulcerative colitis, systemic lupus erythematosus, etc., were not heard of in antiquity or in ancient times when the world was not so ridiculous and fragmented. Also, we would check certain laboratory work such as the comprehensive digestive stool analysis, routine lab work, food allergy panel, intestinal permeability, and a liver function panel, which actually tests how well the liver is working. Some of the symptoms of these inflammatory bowel diseases include diarrhea, blood, and mucus in the stool, as well as pain. The treatments for these inflammatory bowel diseases medicinally and typically include anti-inflammatories such as prednisone, which is the mainstay of treatment, chelation therapy, and high-dose vitamin C for the anti-inflammatory aspects, hydrogen peroxide IV, slippery elm, acidophilus, pardiarco. There's many, and let's not forget some of the alternative therapies from across the water, the venous flytrap derivatives orally or intravenously. We're not saying that this is a cure, but we're saying that there are some really good things that can be done to help combat this and other related diseases. We want to talk about cancer again briefly of the esophagus, the stomach, and the colon. The most important thing is to prevent this, if possible, by eating a high fiber, low fat, high fruit, high vegetable diet, not skipping many meals, making sure that you have adequate bowel movements, avoiding alcohol, other drugs, and especially tobacco, not eating with your meals instead of drinking before your meals. I'm sorry, not drinking with your meals and eating and drinking at the same time, but drinking most of your fluids well before your meals so you don't hurt that balance. And then there's standard and alternative treatments for cancer. If one finds cancer, many times one may want to get the standard treatment if it's not metastasized, and then jump into a strong alternative treatment component. The treatment of gastrointestinal diseases include lifestyle factors such as the food order, making sure you eat liquid first and then solids, raw and then cooked. The food combining principles that we've talked about earlier. Eating rules, making sure you stop eating before you feel so full, etc. Stress management. Diet, the content of the food, the preparation of the food, whether it's raw, uncooked, fermented, such as sauerkraut, or soaked. In other words, it's good to soak beans overnight. You could soak brown rice. You could enhance the cooking of these foods so it doesn't bother your digestive capacities, or stress them, I should say. Staying away from poisons like artificial colors, obvious poisons. We didn't even talk about junk foods, but that's because it's so obvious to me to for one who's serious about being healthy, one needs to stay away from a lot of cheeseburgers, artificial colors, thick, gooey, fatty milkshakes with milk in them, of all things. And then keeping your acid-alkaline balance. You know, acid-producing foods are more the meats and the dairy products because the high protein content produces acids as part of the breakdown products in digestion, whereas the alkaline foods are the fruits and the vegetables, and especially vegetable broth is very, very important as far as the alkalinity of the body. It's a miraculous feeling one can get when one is sick. You can almost be sick and then drink some vegetable broth. And when I say sick, I'm talking about maybe a little nausea, just not feeling well. And you drink that vegetable broth and it snaps you back because of those minerals and because of the alkalinity and other things that we probably don't even know of yet. Then there's supplements such as vitamins and minerals and antioxidants, which should best be taken with meals because you want to kind of trick the body into thinking you're just getting a very nutritious meal. And colloidal minerals, which are taken with fluids. And that includes the toddies that we use, the oxy-toddy, the mineral toddy, etc. I want to go over some of the intricacies of taking supplements. Now, solid vitamins are best taken with the meal, as well as solid mineral pills. Herbals, which we're going to be talking about next, such as teas and powders. Now, if you're going to make a herbal tea, of course, that's taken before the meal or in between meals because that's a liquid again, and you don't want to hurt the digestion. So you will take that in between meals. A powder can be sprinkled on food or taken orally directly or taken before a meal. The powder, many times, if let's say you have licorice root, many times you can empty this out and put it in some juice and water, just juice for a little flavoring, or any herbal, like the cayenne
Smoothie.
Right, the smoothie, the cayenne, garlic, and parsley. You could sprinkle this on your food as a flavoring, or mix it in carrot juice, for instance. You can make smoothies with fruits and herbs and water and frozen fruits and a little bit of juice, depending on what you can take. There's many different ways, and I really would want you to read about herbs to get to know them, because truly our ancestors knew herbs very well, knew how to use them, how to prepare them, what they were for, through years and years of trial and error. And they knew how to work them as well as we do now. Go to a drugstore and buy a bunch of medicine, right? Our ancestors knew how to use the herbs. Digestive stimulant herbs, again, talking about stevia, ginger, cayenne, garlic. Constipation can be treated with bulk-forming herbs such as psyllium, chia seeds, or stimulatory herbs temporarily such as senna and cascara sagrada. Enzymes. Food enzymes should be taken with food to enhance digestion. And there are certain enzymes that you would take when you have a stomach problem, such as peptic ulcer disease. And basically, that would be the gastric complex that we have here. We did have here. Oh, here it is. Gastrace complex, or we can take the similase, which would be taken during other times. We have digestion. We use antiparasitics such as black walnut. We use anti-ulcerative soothing herbs such as slippery elm, marshmallow, mullein, etc. And then we can't stress enough water and exercise. But before I do that, I want to re-stress the enzymes. Dead food does not have enzymes and will suck the enzyme power from your system, which is complex proteins and whatnot, and it will really cause early aging and whatnot and cancer. You want to try to eat as much raw food as is reasonable. In the summer you'll eat more raw food, in the winter you may eat less. Read books on this. There's so much out there, so much information out there, and I really have to encourage you again to read. I want to talk about exercise, crunchies, deep breathing, stretching, jogging, running. But the mainstay of exercise should certainly be the stretching, light aerobic exercise, deep breathing, all those sorts of things. And then muscle building exercise is important to give you the capacity to do other exercises actually. And then water cannot be stressed. Use pure water. Boiled water is boiled chemicals. Use filtered water, spring water, distilled water. I also want to mention that the lymphatic system is stimulated by water intake, it's stimulated by exercise, and it's stimulated by massage as well.
What is it?
The lymphatic system is a system of waste removal from in between the cells, so to speak, the interstitial areas, because the cells excrete waste not only in the blood but also in between themselves. And exercising will squeeze the tissues and push that fluid back toward the heart, and so you can detoxify it out the bodies, and it'll really help your state of mind and also relaxation and help prevent and treat other chronic diseases. Enemas and colonics. Enemas are self-administered. They can be a very superficial enema, such as a Fleet's enema or a high-hang enema, which we talked about during colds and flus. And those enemas can be very, very important when you are detoxing your colon, because you can take the herbs and drop the feces into the large intestine, and then the enema can come and help wash it out. And you'll have to read or go to a health practitioner if you really don't know or have some major problems. Enemas and colonics should be used in caution with people with colitis, active inflammatory problems such as diverticulitis. You could actually put a hole in the colon. But for most people, that's not going to be a problem. Okay? Colonics are administered by a colonic therapist, usually trained. I would prefer to use people who use disposable catheters that go into the rectum. They can be very invaluable. Many people have taken a series of them for great health. I've taken several myself and can attest to that fact. As they say, death begins in the colon and life can start there. One can really eradicate and treat a lot of digestive problems. That's one of the main reasons people go to doctors these days. And I hope that this small introduction will stimulate you to read more, especially if you're having some personal medical problem, or to seek a natural health practitioner out. This is Dr. William Richardson of the Atlanta Clinic of Preventive Medicine here in Atlanta, Georgia.